my name is Tyler Dollenberg, and I'm doing a lecture on bone marrow donation. Thank you to my mother for sitting in on this lecture today. If you had a choice to live or die, what would you do? If you needed a transplant from a stranger that could give you your life back, would you take it? These are questions that I'm asking you to think about. You have the chance to be part of a life-changing opportunity and to save someone's life. Take a moment and listen to my story before you make a decision. Let me tell you a little story about a woman named Evie. At the age of 53, Evie was diagnosed with stage 4 lymphoma. Thanks to Gift of Life, she received a successful transplant and was able to witness the marriage of her daughter and the birth of her 3 grandchildren. Evie is very involved in giving back as a special advisor to Gift of Life and co-founder of Swab a Cheek, Save a Life. Gift of Life is committed to curing blood cancer through marrow donation. Its goal is a match for any patient in need, wherever they may need one. Leukemia is a random killer. It can strike any one of us at any time. Cancer plays by its own rules. But for many, there is hope of a cure through a bone marrow transplant. In fact, 1 in 200 Americans will receive such a transplant in their lifetime. This is exactly what happened in 1988. My cousin Tori was diagnosed with leukemia at the age of 5. For 2 years after her diagnostic, she finally went into remission. Unfortunately, she was in a terrible car crash and spent several weeks in the hospital recovering from her injuries. As a result of the accident, she was no longer in remission. Her doctors believed the accident messed her up, and they had a very difficult time trying to get her back into remission. The next few years were agony for Tori and her family. There was no treatment the doctors tried that would work on her any longer. The only last option was for a bone marrow transplant. Of course, my cousin, his wife, and their other daughter all got tested to see if they'd be a match for Tori. The only one that was close was my cousin Henry, her father. It was a desperate time for all of them. The only option Tori had to live was that bone marrow transplant. Bone marrow donation is a huge commitment in saving a life. Understanding the process, recovery, and side effects can help you decide if donating your bone marrow is right for you. The procedure is done by a hospital by a qualified doctor. The doctor uses a needle to withdraw the bone marrow from both sides of your back of your pelvic bone. You will be giving anesthesia and feel no pain during the donation. After donation, your liquid marrow is transported to the patient's location for transplant. The first step is to have your bone marrow tested. This is known as a bone marrow biopsy. A bone marrow biopsy is a procedure when they take a small sample of your marrow inside your bones for testing in a laboratory. This test is used to see if you have an infection, disease, or other problem in your bone marrow. Bone marrow is a spongy tissue found inside your bones. In the larger bones, such as your spine, breastbone, hips, ribs, legs, or skull, bone marrow contains cells that produce white blood cells, red blood cells, and platelets. If it is successful, the patient will begin to mimic the reproduction of a healthy white, red blood cell, and platelets, and will be in remission for hopefully a very long time. Unfortunately for Tori, it didn't work, and not long after the procedure was done, she began to decline and passed away on July 2nd, 1988. The registries typically require donors to be at least 18 years old, but no older than 60. Everyone's situation is different. However, if you feel that you are healthy and could possibly be a good donor, don't hesitate to contact the registry, and they will let you know their latest guidelines. If you would like to sign up online, this would be the best place to look: www.marrow.org/join. Not every person who chooses to donate his or her bone marrow is acceptable to the patient. There are times when the patient's body may reject the donation. This is not a guaranteed selection. However, living with the regret of not donating when you are clearly a match is worse than any discomfort from the recovery time of having the procedure. Why wouldn't you want to at least attempt to save someone from dying? You have choices, but the patient doesn't. There is no time to waste. The one question you should ask yourself is, what if it was me? You have an amazing opportunity to give life to a dying person. Even if you are not a match for that person, your biopsy results can be entered into the bone marrow database for future opportunities. The gift of life is the most precious gift you can ever give to somebody. You never know when that person might be you. Desperate to survive, wouldn't you want that one person who could provide you with your life back to step up and sign up? It's time for you to make a decision to save a life. Thank you for listening to my lecture.